what brought me to Journey Clinical, it was really a dream of mine to be a psychedelic-assisted therapist for a while. I consider myself a little bit of a psychedelic nerd. Any podcast, book, documentary, like if I could get my hands on it, I was trying to learn about it. Once I went through graduate school and I was working as a social worker in high schools, I earned my clinical license and I was just so ready. And so Journey Clinical seemed like a great way that I could build my private practice, incorporate psychedelics in a way that gave me a lot of support, but also gave me a lot of independence at the same time. The training opportunities are fantastic. I felt like I had a huge community of therapists to go for questions, and so I'm very glad that they were there to help me because I'm still in my first year of private practice, and yeah, it's been a great partnership so far.
I feel like this could be like a very long story, but in terms of why like now Journey Clinical, as soon as Naropa announced that they were doing a psychedelic assisted therapy certification, I signed up. And it was one of those things where it was like very expensive. It involved traveling to Colorado a couple of times, but I knew that I had to do it and I would figure it out. And I hadn't been in private practice for that long. But anyway, I signed up for that and did that and was excited, but was really enthusiastic about psychedelics for therapy. So did the Naropa certification, and there was, we had to do an experiential for part of the training. And I chose the 4-day wilderness fast because I knew that was something that I would never seek on my own, and that I could do psychedelic journeys in many places with many different groups of people, and I'm like pretty connected to those communities. Not enough people signed up for the wilderness fast, so they canceled it. And then the only other option for me at that time was the Prati training. Prati is a Colorado-based ketamine, it's Psychedelic Research and Training Institute. Yeah, I think that's what it stands for. Great group of people. They did the ketamine therapy training, and it was like a retreat style. And that was really my first, well, I had a couple experiences with ketamine in the past, but that was the first time I really experienced ketamine, and definitely the first time I experienced it in like a therapeutic context. And it totally changed my attitude about ketamine, and I could really understand how it could be therapeutic, aside from like psilocybin and MDMA. I think I had already signed up with Journey Clinical at that point because I just knew that ketamine was, to me, it was like a foot in the door of psychedelic therapy, and it was the thing that was legal. So I had signed up with Journey Clinical, or as soon as I heard about the Journey Clinical, I signed up. Felt a little wary because the Prati people were really like adamant against doing virtual ketamine work, and I felt, at that time I had no experience, so I didn't really have an opinion one way or another. But ended up, came back from that, and there was this whole, talk about like you have to get a medical, somebody to do the medical prescribing and all this stuff, and it all just sounded like a lot and like overwhelming, especially for someone who's just still trying to figure out a private practice and just other aspects of life. So once I, really got going with Journey Clinical, and had more of my own experiences, I worked with people in person, but also realized that it really does work well remotely. And then there's other companies like, maybe I shouldn't say the name, but where people are just like on their own with the ketamine, and that definitely didn't resonate with me. But yeah, the more I did work with Journey Clinical, the more I felt like it was a really great organization and felt really supported. And I went to the Psychedelic Science Conference and met the crew in person, and that's what made me really excited about working with Journey Clinical, because the people behind Journey Clinical are people that I would want to be friends with and that I want to work with. So, yeah.
It's good. Kind of similar. I had more of a background with plant-based medicines, and I was weary of ketamine at first, but I'd went through MAPS for MDMA assisted therapy, and one of the things that I really valued there was community and being able to be in a cohort and collaborate with other clinicians. And I think that a lot of my journey through being a therapist and then just wanting to integrate psychedelics and altered states of consciousness was in isolation. And so when I saw Journey Clinical and the model and what they were offering around building community and having something where clinicians could actually talk with other like-minded clinicians, that was something that I knew I needed. I needed to nurture that part because it's lonely in private practice. And through my own journey and being able to find a facilitator that really was able to hold space for me. I got to see the benefits of KAP and the difference it is when you're doing it in a therapeutic setting versus a party setting, which a lot of my friends, people I grew up with, that's where they were kind of lost in the more party scene. And so being able to kind of understand how a medicine can be supportive, but it, with having the safety of someone else with you, it just gave me a space to really train for when MDMA and psilocybin are fully legal. But then also recognizing how ketamine is different and it can be a supportive medicine in different settings, different experiences. I work with a lot of trauma clients, and just getting to see them breathe for the first time and let that sigh of relief go, that was the big shift for me. And when I really became all in for like Journey Clinical and just supporting other clinicians that are kind of making that jump into psychedelics. I think that when we band together, policies change, and I think that this has been a place that we're seeing a lot of support and pushback from the old way of doing things and really being able to integrate the newer ways of healing. So, yeah, that's what brought me here.
So I have been following psychedelic research since I was an undergrad at Berkeley. I graduated and I sent Roland Griffiths an email that I wanted to work with him, and he kind of like sent me a response that was like laughing and told me to go get more research experience. So I went and applied to labs and was always interested in relationships. I've been interested in how psychedelics can heal relationship trauma and disconnection in relationships. So started grad school and studied couples. Unfortunately, I did not study psychedelics through grad school. I continued to follow the research on my own and had an opportunity in San Diego to finally bring those two worlds together. So started to do MDMA-assisted couple therapy PTSD research. And I was consulting for a startup, a ketamine-assisted therapy startup, and had some meetings with Jonathan. And that startup fell through. But when Kayla and I started our private practice, we're still full-time in our academic position, but started our private practice in Emory. We wanted to incorporate psychedelics, and so got back in touch with Journey. And we love ketamine for couples. So when couples are coming into couple therapy, it's typically because they're stuck in some dysfunctional pattern. And ketamine allows us to move into this observer perspective where we can see our patterns from a different space. So rather than me against you, which is how couples typically come in, it can be kind of all of us looking at this pattern together and shifting this pattern together. And with ketamine, we have more cognitive flexibility, more openness, more empathy, less avoidance. So we are excited about other psychedelics, but ketamine is a wonderful tool for couple therapy.
We're here in San Diego. There is a scene where there might be recreational psychedelics readily available. And I wanted to ask you, and you can kind of, pass the mic, whoever wants to respond to this. If a client were to come to you, or not even a client, just a person were to come to you and say, hey, I have access to these psychedelics. I can do this work on my own. Why should I sign up to do this work with a therapist? What would you say to that?
I smile. I smile because that's actually how I started doing prep and integration for a lot of military, because they were tired of SSRIs and they were tired of being on other substances. And so being able to talk about the actual cathartic experience that can occur when you do feel safe, when you don't have to monitor yourself, that was actually a selling point in a lot of ways for clients, as far as like the safety issue. Like, even if they get to a place where they have this aha moment or this experience, it would be lost because they would be by themselves, versus having someone there to be able to just listen, to hear, to reflect, to be able to do the integration process afterwards. Even during this time, that's what I've I've promoted the most of is the prep and integration, because that really is the relational piece where most of our wounds come from relationships that happened earlier in our life. And if we're able to be in a space with someone else, a lot of times we can see that healing. And with those default mechanisms down, like, we can actually explore it versus continue to be triggered by it. And that's kind of how, like, if I had someone to wanted to talk about that, I would bring that up of, like, do you want to repeat the same pattern, or would you like to transition? Would you like to grow? Would you like to be able to evolve your behaviors in a way that's authentic to where you want to go?
I just want to add a couple of things. There's also the fact of you can get ketamine off the street, and plenty of people do, and you don't necessarily know what's in it. So there's like a safety element. When you're getting something from a compounding facility, you know exactly what it is, you know exactly how much it is. In terms of, maybe it's possible. I don't know that it's possible to reach the level of psychedelic experience by snorting ketamine that you do by either IM or by doing the lozenges. So I think, it's a different experience. There's also the fact that, like, for people that use it recreationally, I think people do get benefit from it. When you're kind of in a social situation, even if you're having, like, some great insight, I think you lose something when you're kind of socializing with people. You're in contact, you're in relationship, which at lower doses can be very beneficial and therapeutic, but it's a different experience. And I think, what you really get out of it doing these, like, high dose individual going inward experiences are these great insights that maybe wouldn't be accessible if you're in an environment where there's lots of distractions and people talking to you and you have to navigate the world. So, different.
Yeah, I was having coffee with a friend this morning who was planning on doing one of their own journeys recreationally, and he was like, I just am, like, looking for enlightenment. I was like, okay, and, like, what are you going to do with that? So integration really is so important. I think lots of people have recreational experiences that are beautiful or challenging, and they're these siloed events. And so actually meeting with someone after and talking through what came up for you during the experience and what changes you actually want to make in your life is the only way that you're going to have any sort of long-lasting behavioral shifts.
Those are some great answers. Thank you for that. I want to move on to the outcomes that you are seeing because you're doing this work with your clients and you're supporting them. So if you have any stories that you would be willing to share about those outcomes, or if you want to frame things more generally in terms of who KAP can be a good fit for, I think that would be really interesting to hear.
Well, something unique I think that I've been seeing with people who identify as artists or creatives are often also very sensitive people that can struggle with anxiety, depression, trauma. And I've had a few clients go through a ketamine dosing series, and the day after that neuroplastic window have felt a surge of motivation and inspiration to create. I often think a lot of times mental health symptoms are there because we're in a rut, we're in a routine, and it's a pattern that's not working for us. And so with ketamine, the neuroplasticity, it just creates more space. And so I've had a few clients that make music and a song will flow right out of them the next day. I myself like to paint for integration, and I love creating art in the next few days after my journeys. So that's something something a little more unique that I've seen with people, and I think it's definitely something that gets people excited if they felt uninspired or unmotivated. This is a way to break out of that.
Something that I've seen and get really excited about is people getting off of their antidepressants. People being on antidepressants for decades sometimes, and then through their ketamine, treatments are able to start, getting off of them. And so that, I don't know, I'm excited about that because I have feelings about just how the length of time that people often are prescribed, a multitude of of pills, and then they're still anxious and depressed, which leads them to ketamine. That, and like one client popped into my head who had pretty severe harm OCD. He was, I think, my first ketamine client, actually. And I told him, this is a new modality that I'm working with. He was I was very transparent about that. It was, at the time, brand new to me, and he was willing and interested in trying it. And I'm not exactly sure. Like, we did other things with it, obviously, in our integration sessions and things like that, but he hasn't had a harm OCD in years at this point, and it was pretty debilitating. So that's one of those, a case where it's like a very clear shift. Yeah,
I think the capacity to sit with the pain and suffering, like if we have clients, I'm thinking of someone in particular where they've suffered for years, there's like endless trauma, never feeling safe in a lot of ways, and just recently in this KAP session, there was a lot of expectations, and it wasn't this instant, everything's good. It was like, there's a lot of sorrow here, and just not being able to really recognize it for so long, and just sitting with it in that room, and being able to cry it out and to let those emotions be seen, because the way that this client has to show up in the world, they're not allowed to show emotions. And so to be able to break down those walls and those barriers to where someone can actually allow themselves to rest, it's monumental. And I even speak to my own experience in that when I was able to receive KAP, that was something I didn't realize how much I had been holding back. And it took me going through that experience, being in that state of vulnerability, being able to trust the clinician to just know that they're going to be there through the experience. It's kind of monumental that we have this that we can use in therapy, and a lot of us have been holding space for our clients for a long time and wanting them to be able to heal, where this is an opportunity. So
I think the only thing that is different, so with couples, we can kind of see all of this, and also like healing that is happening between the partners in the room. So if there are stories around like being unlovable or being undesirable or not being enough, and watching individuals say that to their partner, whatever that like deep sensitivity or vulnerability was, you are lovable, you are enough, and seeing that softening, and they're wearing eye masks, but like seeing tears roll down their face, and then like they're crying and I'm crying, is just like, it is so rewarding to see that emotional shift happening in front of your eyes between people who love each other but have been kind of so lost and disconnected. If you're a therapist, I would say get a partner or a team or a consultation group. There's going to be a lot of challenging things that you're navigating, from running your private practice to things that are coming up with patients. So yeah, doing this work with a team is so much more fun and so much easier, and I would definitely be lost without Kayla. So if you can find a good partner, do that.
Yeah, for people that are considering doing KAP or as a client, I would just say vet the person that you're going to have hold space for you. Be curious about them, ask them questions, trust your intuition around, are you able to be vulnerable with this person? I think that that's a big thing that we don't talk about enough, that like that right match for clinicians and the client, and then just future intentions. For myself, I just hired 2 associates, so I do plan to work on putting together workshops and trainings for facilitators, but then also just for groups within these communities, and like continuing to grow the knowledge and letting people know about how this can support their healing process.
I always like to encourage therapists wanting to do this work to really have your own experiences with it. I think it can also, I mean, in general, being in the psychedelic world as a clinician, people will come to you and will ask, is it like mushrooms? Is it like, having things to compare to? This came up recently with a client that, 2 months ago, she had done an ayahuasca journey and was kind of expecting it to be like that. And because of my own experiences, I could kind of speak to her on what's different and how, it kind of normalized the fact that her experience with ketamine was like a whole different thing. And so not that you need to like go out and do all the psychedelics, but it is helpful to have experiences and to do your own work, like in grad school, I'm sure you were told like you can only take the client as far as you've gone. It's kind of, I can't imagine trying to do this work and not having had my own, like quite a bit of experience on my own with going into these places in consciousness. And for clients interested, I would, I guess, just encouraged to try it. With people who are a little bit ambivalent, the way the Journey Clinical model works, it's like they meet with a medical provider, which also now Journey Clinical is taking insurance, and that's what I'm really hopeful for the future. So kind of jumping to the other question, more insurance coverage, hopefully insurance coverage for the actual dosing sessions, just to make this so much more accessible. There's so many people that I work with through insurance that they're on so many medications for chronic pain and all kinds of things, and even though they're really interested in trying ketamine, it's just not going to be financially possible, at least not for now. Or they have to take lithium before their insurance provider will approve them for ketamine. So there's that. Back to the other piece, for clients interested with Journey Clinical, they prescribe for 2 sessions worth. So you could always kind of suggest that they do the medical assessment, do a couple sessions, and if they don't want to do 1 session, and if they don't think it's helpful or it's not for them, they don't have to. I also explain that they can start at a very low dose to just kind of get a sense for what it feels like you don't have to go into a fully psychedelic experience the first time, because a lot of now psychedelic therapy is pretty talked about a lot in the media and stuff. People are curious, but if there's fear around it, those are ways that I try to diminish some of that fear.
Yeah, I agree with Brooke that I love the expansion of insurance helping to support ketamine-assisted psychotherapy. I think that increases accessibility. That's really what I hope for years down the line. But for my advice for someone as a therapist who's recently joined Journey or thinking of joining Journey is to really dive into all of the resources there are. There's a whole library full of webinars to watch with loads of information, a lot of experts in the field on all different topics. The consultation groups have been fantastic. I've really enjoyed learning from clinicians that have been in this field for a while. I joined one with Claudia Chica, and now I know, if I ever have a question, I have a personal relationship with her to ask. It's been great to be plugged into the San Diego community of therapists. I've gotten a few clients referred to me through friends that I've made in Journey. Options to share office space, which has been fantastic. So yeah, really just diving in. There's so much that platform has to offer, and a lot of really friendly, amazing people that work with Journey. And so yeah, take advantage of the membership. You'll get as much as you put in.